Okay, you brought some before and after photos.
Correct. So if you were to look at this photo, could you honestly tell me that this looks like a hair transplant?
Let's take a look. Let's take a look. No. No.
Impossible. Impossible. And because you think about how it's done, we're transplanting one hair, 2 hairs at a time. If you get an injection in your arm and they pull the needle out, can you tell me where the site was where they stuck the needle out?
No.
Impossible. It's the same thing. We're creating a site the size of a hypodermic needle, inserting hair in there. It heals, and you cannot tell that was transplanted hair.
So nowadays, I mean, really, with what you're doing now, you know, you can't tell.
You cannot tell. You cannot tell. I think the giveaway to me as a surgeon is the design. You know, I look at somebody and...
So you can spot it.
Oh, absolutely. It's the profiles. I look at the profiles. If they got a hairline that's coming way out here and they've lost all this temporal peak, I'd say, wait a minute, something's going on here, you know. And so, yeah, right. I can tell.
So what are the keys? Okay, so what are the keys to a natural hairline? Define it.
Well, when you know, if there has no hairline, you got to recreate it. Why, one thing you always, first of all, you keep this distance and this distance the same, because
from the nose to the chin.
Right.
Okay.
Because the most important part of your face is your eyes. So when we're doing a hairline, we don't want, when we're done, people looking up at your hairline.
Okay.
When they talk to you, they want them looking at your eyes. You not even know that there's something going on.
All right.
If you lower the hairline too much, they're automatically going to look up there. On the profile, men will many times lose this, what we call temporal peak.
This little area, right?
Right.
Okay.
Now, that's a really important area to restore, and it's so simple to do because it's an easy transplant. It's when you transplant this side, the hair is layered, it's growing down, so you'll create the illusion of a lot more hair in that area without a lot of transplants. It immediately will make the person look younger. You know, I've showed many guys when I show them their photograph and add hair to it in Photoshop. I said, let me just show you something, and I add just a little bit of hair in that area. They're amazed how much it changes.
So the keys to natural. Okay, so the natural hairline, you got to hit those sides, and or else it'll be a big block look or something.
Well, it comes down straight, so the hairline comes around and comes down straight. That's what normal hairlines don't look that way if they got hair out in here. You got to recreate this profile. Okay. And then the next area is the recession area here. You know, the area that you're concerned about.
Yeah.
You know, how far out do you bring it? You know, what would look good? I mean, you know, I get guys in here that want their hairlines coming down like that. Well, that's a female's hairline.
Do they really want that?
Oh, all the time. Yeah.
So you have to talk them out of it.
The younger they are, the more aggressive they want you to be. My youngest patient's 18 years old, and my oldest patient's 85. So that's a wide range, you know. I've broken this down into 3 groups. The guys under 30, the guys from 30 to 50, and then the guys 50 and over. And they all fit certain categories and certain characteristics. The guy in their 20s, they're not ready for hair loss. I mean, it's devastating. They'll do anything, but they can't afford it a lot of times, you know, or their expectations are not, you know, realistic. And the earlier they lose their hair, the more they got to be concerned 20 years from now. They think 40's old.
Okay.
You know?
So, I mean, they're headed, they may have to get a touch-up at 30. If you're 20, touch-up at 30, touch-up at 40. Is that correct?
Well, yeah. I mean, you treat them now with the idea this is going to put off the inevitable, that you'll probably lose more hair and come back and want more. You know, you do it in such a way that they won't have to, you know. You design it that if they just do this once, they'll always look, quote, normal.
Okay, okay.
But what'll happen is, you know, you'll lose more hair, and you think, you know, I'd like to add a little bit more hair in there. So you come in and you do it, you know.
Got to call Dr. DeArmond, is that right?
Well, that's...
They put you on the speed dial.
Yeah, you better.
You better, okay.
No, but I mean, and then you get the guys in his 30 to 50, you know. Well, for the first time in life, they can afford it, you know. They're guys that, you know, they're usually pretty cocky. They really, you know, they want to feel good. They want to look good. They want the edge.
Yeah.
You know, and they are good candidates. And then the guy over 50, he obviously wants to look younger. you know, and he's most gratifying. I mean, you take a guy that's completely bald and you give him back his hair at 50 years old.
Is that right? You can do that?
Oh, absolutely. Do it all the time.
Now, I see these commercials where these guys, after they get their hair, they're canoeing, they're swimming, they're running, I mean...
all very common.
Is it like a new lease on life? You get your hair back?
I can't tell you how many guys get their hair back, their health improves. They start losing weight, they start exercising, they start taking better care of themselves. So it's very important. You know, when you give something back to somebody that they thought they lost forever, they're so appreciative.
They're happy.
Oh, very much.
Okay, more photos. Let me see what else you got here.
Well, here's this guy here. This is my 18-year-old boy. Now that changed his whole life. He was, his self-esteem, he had none. He was, feeling more and more depressed about this. His mother was amazed how he changed when his hair started to come back. And we did one procedure and completely changed it.
Let me take a look at that. Let me take a look at that. Okay. Yeah, it's very nice. Looks very natural.
Mm-hmm.
Looks very nice.
And he was very understanding as far as design is concerned. I said, "No, we got to do this in such a way that as you get older, you'll look normal, look your peers." That's what's so interesting because they take so much abuse at this age. If you start to lose your hair, it's your peers that give you
a lot of bald jokes.
Oh God!
Do they tell you that?
All the time, all the time. Hey, you're losing your hair. They don't want to hear that.
Wow. Interesting.
Now, here's
okay.
a guy. This is a gentleman that's in his 30s.
Now this is a great result. This is really something.
This completely changed his life.
Let's take a look here. Oh boy. Yeah, it's very natural.
And completely different look. People, this next one I'm going to show you is people always ask about density. How thick is it going to be? Now look at this.
That's the top. Interesting. And that's combed forward a little bit.
Right. To show
how many grafts? 5,600 grafts.
In one session. In one session. And nobody in San Diego, nobody in Southern California does that.
So when you present to other doctors at meetings and you show them this, because some people would argue behind the scenes, this is not a good business model, because one guy is taking up your whole day. Is that right? That means when they see you're putting 5,600 grafts, it takes a while.
Right, right. I always tell guys, the clinic that does, let's say, 3 a day. Would you like to be the last patient that day?
Okay.
Can you imagine? The help's tired,
everybody's tired.
Yeah, one more. No, I think no matter what the number is, your focus should be on that one person that day. And by doing it that way, you're not going to, you're going to do what's right for the patient, really.
One a day. Okay, good for you. What else? Now this guy's famous.
This Sam cooking guy. Now that's a good example of somebody coming to me and saying, I have an image that I want to maintain.
Okay.
So he showed me what he wanted. He didn't want to look like he did 20 years ago. He wanted hair added to his thinning area and connect the sides because he was losing the hair from his frontal hairline to the sides.
It's very subtle, but it's nice.
You can see it, yeah. And Sam, he's so recognizable,
Yeah.
and he got what we did what he wanted. This is another large case, and this gentleman here.
Well, this is a nice one.
Military guy, had the short haircut, come out of the military, wanted his hair back. We restored the whole top of his head.
That looks very nice. And they could style it however they want. Most of these guys are going back. This guy went on the side.
He combed it to the side. He parted it.
Now, it comes from the back of your head, is that correct?
Right.
And so it's not going to grow in kind of funny? Do you have to tilt the hairs?
Well, you follow the direction of the surrounding hair. So it blends in and looks like your own natural hair.
Okay.
Now, here's a guy that's in his 50s. Now, he looks 20 years younger.
Yeah, he looks better.
Unbelievable.
It looks good.
Unbelievable. It was such a positive change here, And we did that one time.
How important is hair, by the way?
Well, it's very important.
To having a full head of hair rather than a receding hairline.
It's very important. What men do, though, is accept it. They think to themselves, there's nothing I can do, I look fine.
Okay.
And certain men shave their heads do look good, but other men shave their head it's very threatening.
Yeah.
It creates an image that you really don't want to have, especially in certain businesses that you might be in. Men don't want to be laughed at. So they don't want to do something that would make them look silly or ridiculous.
Okay.
So it's really a fine line in telling them, you know, hey, there's something we can do, something that you'll be happy with, something that's going to enhance your appearance, you know. And if we get over those barriers, and they do this, they're very, very happy that they did, you know. It's just so difficult. And money, they don't want to spend the money. Men hate spending money on themselves, you know. While women, you know, they do it all the time, you know. So it's just priorities. And
women, by the way, there are certain women. I mean, I know somebody that says, you know, I like bald men. She has a husband that's bald. But anticipating this interview, I've asked women, what do you think of bald men? And these women said, it was only 3 of them, I would never date a bald guy. Never. Now, I don't know if that's true or not, but there are certain women that, you know,
I think it's usually,
she goes, maybe if I fell in love first and then they went bald, I'd be okay with it. But I'm not going to start with a guy with a receding hairline.
Exactly. And
that's terrible, by the way.
I think that the women that like bald men, it's usually their father was bald.
Okay.
You know?
Is that right? Good point.
You know, there's something there that they relate to. But most, I can't imagine. If you say, you know, you had your choice, would you want to have your hair or not hair? I mean, come on, you know, let's be realistic.
Everybody wants hair. I guess I take it for granted because I guess my hair is pretty good.
Exactly. It's amazing. You know, the guys are losing hair, he's doing something about it, and his buddies that have hair. What are you doing something for? Well, you don't. How can you relate? You have all your hair. You know, I want to look and have hair like you got.
I talked to a guy about you coming on the show, and I said, do you worry about your hair? He says, I'm married. I don't care about my hair. You know? And I mean, for some people, I guess, it doesn't bother them. Do you think there's such thing as a happy bald guy?
Absolutely.
Okay.
Absolutely. I mean, there's guys that...
So they're not secretly miserable?
No.
Okay.
No.
But they wish they had hair, you think?
Well, if they get divorced, and they're going out looking.
Oh, good point. Okay.
You know, that's one of the first things they'll
be knocking at your door.
Oh, yeah. Yeah. Yeah, I mean, short hair's in too, you know?
Okay.
And so that's a real challenge, you know, try to design something and create something that will, you know, people won't know they're having it done, and you know, and it gives a subtle change, not, you know, a lot of...
Do you see all ethnic groups, by the way?
Oh, yes.
So everybody's a candidate?
Yeah.
Is that correct?
Yes. Yeah, everybody's a candidate. You know, the question, can everybody get the outcome they're looking for? That's the hard part.